Hello, my name is Meredith Gilliard, and today we'll be going over the ethical adoption of AI in nuclear medicine imaging. In this presentation, we'll be exploring the role of artificial intelligence in enhancing safety, quality, and efficiency in nuclear medicine imaging practices while also ensuring ethical standards. The introduction to AI in nuclear medicine. Before I move on to the next slide, I do want to say that the research was very interesting when I was doing my proposal for this topic and overall just looking into this topic as requested by my teacher, Miss Susan Austin, to look into our what's it called, our work fields, our future jobs, and whatnot, to find out what issues that we could find in our fields of study. I found that imaging also often has issues with blurry images and inaccurate images. So I my first thought was, how can we possibly fix this and move forward so that way we can have clearer images. And then that led me into a whole nother onset of different issues that are found in the imaging practice that spans from nuclear medicine to even sonography or just stuff like that, which is all really, really cool and really unique. So, of course, none of this is actually happening now, but it'd be really cool to see how it happens. And that's kind of what we'll also be breaking down as well. So AI technology is transforming nuclear medicine imaging by improving patient outcomes. It enhances safety, boosts image quality, and increases workflow efficiency, making medical procedures more effective and reliable. If you didn't know, different clinics often use different dosages for uh, radiology. So in one clinic, the doses may be higher, and a different, it may be lower. So just little things like that matter when it comes to introducing a whole new machinery or technology, which is AI. Um, and here's the importance of scan safety. So reducing radiation exposure for patients. We kind of just explained this. Different institutions use different amounts of radiation exposure. AI technology can analyze imaging protocols to ensure optimal radiation doses, significantly lowering exposure levels for patients during scans. This is crucial in protecting patient health while maintaining diagnostic quality. Minimizing errors in image acquisition. So AI can also assist in identifying potential issues before images are taken, thus reducing the likelihood of errors during image acquisition. This results in higher quality images and fewer repeat scans, enhancing the overall workflow. Also enhancing patient monitoring during scans. With AI, healthcare providers can continuously monitor patients during scans. This real-time oversight ensures quick responses to any adverse reactions, significantly enhancing patient safety and comfort throughout the procedure. So if you didn't know, you have to stay really, really still when you're getting a scan. And if you move, they have to do it all over again. So imagine someone with there's a disease, I don't know the name of it off the tip of my tongue, but if you can't, they basically where they can't sit still, they're constantly moving. Imagine that Parkinson's, I believe is what it's called. Imagine someone with Parkinson's disease having to get like an MRI or something like that, and he's required to sit still, or that person is required to stay immensely still, and they can't, and so they have to get it taken again. So the repeat radiation exposure, of course, is not healthy for the human body. So with the acquisition of AI into the whole scanning, MRI, and CT, PT scans, that whole process of scanning, it could just help with the images coming out clearer by allowing it to focus on what's important and minimize what they call noise in the image. And that whole study of everything is just it's really cool, really unique. But yeah, just hypothetical situation. Imagine that, even though I'm sure it's happened before. But yeah, it helps people. It could help that whole imaging process, which is overall just super dope, super cool. Enhancing image quality with AI. So all of these things are things I've kind of already prematurely kind of touched on with improved image resolution, advanced noise reduction, and real-time image analysis for better diagnosis. I probably didn't say that last part, but nonetheless, I still kind of touched on all of these, but we'll still go over these slides. So AI algorithms can significantly enhance image resolution by using deep learning techniques. The cool thing about AI is how you can integrate what you want it to know. Of course, all this stuff one has to be interjected or introduced morally and ethically, but safely as well. So I'm curious to see if it does happen, which I'm hoping it happens. I know some of our research articles, people in or doctors in Korea are practicing this, just the introduction of AI or integration of AI into their workflow, and are seeing pretty promising results. But I'm just curious as to how it's going to continue to grow to where it's more, for lack of better words, mainstream, quote unquote. But yes, and then after this, we have advanced noise reduction, and then we have real time image analysis for better diagnostics. This is also really cool as well. Can see something and then immediately tell you what's going on. Like I wrote in my proposal, the scary thing though is people just taking its word at face value and not using their knowledge anymore, which I hope doesn't happen. I'm sure that if you're in that field, you love doing that work, and I know that I would love doing that work. It's very hands on, but yeah, just seeing it and saying, okay, the AI is saying this, so let me roll with that. Let me roll with what it's saying instead of doing any extra research, any extra digging. So we got to make sure that we, as a collective, and nurses, doctors, and all of our future medical people, that we're looking into it, and we're not just saying, okay, it's saying that he might have a tumor in his brain, but when you go and do the surgery, there's no tumor in his brain. I doubt it would ever really get that far, of course, but still, I think, of course, we got to look into it. And but nonetheless, it's still going to be really, really cool to see it all happen and come together. Curious to see how it's all going to come together. Improving workflow efficiency. Now, I admit when I first started doing this research, one of my first thoughts was, am I going to have a job in the future? But the good news is that people or doctors and nurses and techs aren't looking to integrate AI for the purpose of not being able to work, but more so to make their work days a lot smoother and easier. I could only imagine a day where someone is using a machine that's probably a little outdated and they're just probably sick and tired of it. Like, I want to go home. So hopefully, like the introduction of AI would probably be a really good thing for them, helping them keep their images clear and keeping and just improving their day to day work life. Let's take a look at some of this. Streamlined scheduling and patient management. AI systems can optimize scheduling by analyzing patient flow and resource availability, ensuring that patients are seen promptly and efficiently. This reduces bottlenecks and improves overall patient experience. I kind of did branch off and just thought about integrating AI into the whole hospital. The main reason that I did that, though, is because of the differences that the institutions have when it comes to dosages. So, one of my first few issues that I was going to originally focus my entire research topic on was streamlining all these different hospitals. So that way they have like a little device that lets them know what the standard dose is or what their competitors or neighbors are doing as far as dosages. So that way, if there is a concerned patient, they don't have to exactly leave their facility to go somewhere else, and a whole bunch of other things as well. But of course, that's not what I'm focusing on here. I'm just more so talking about the introduction of AI on a different level other than imaging, such as just making their days a little bit easier outside of imaging. Automated image processing. Image processing tasks that previously took hours can now be completed in minutes. AI algorithms enhance and process images automatically, allowing radiologists to focus on diagnosis rather than technical adjustment. Automated image processing. Image processing that image processing tasks that previously took hours can now be completed in minutes. AI algorithms enhance and pre-processes images automatically, allowing radiologists to focus on diagnostics rather than technical adjustments. Now, I don't mean this to a literal T. I think radiologists should still look at images to make sure that what the AI is saying is correct. Make sure it's not generative AI. Make sure the AI isn't adding things into the images, but more so, let's say it produces the images produced, the AI reads the image, and the AI gives feedback on the image, not the AI is making the image itself. I think that's the most important thing here, because we still want our radiologists to be able to infer and look at what's going on here and use their actual medical knowledge, so that way we can, we can improve. That's really it. Faster report generation. AI can generate reports in real time, significantly reducing the time it takes for radiologists to finalize their findings. This not only speeds up the reporting process, but also improves the turnaround time for patient results. Research supporting AI in nuclear medicine. Recent studies demonstrate the significant benefits of AI enhancing diagnostic accuracy, reducing operational delays, and improving patient care. Ethical oversight in AI adoption. Pros: enhance patient safety and diagnostic accuracy. Okay. In diagnostic accuracy, implementing ethical standards in AI adoption can lead to enhanced patient safety and improved diagnostic accuracy. AI systems, when designed with ethics in mind, can assist healthcare professionals in making informed decisions, ultimately benefiting patient care. For instance, AI can identify patterns that may go unnoticed by human eyes, reducing diagnostic errors and ensuring that patients receive appropriate treatments more promptly. Cons: bias and data privacy concerns. Conversely, the integration of AI in nuclear medicine raises concerns regarding potential biases and algorithms that could lead to unequal treatment outcomes. Moreover, the handling of patient data must be managed with strict adherence to privacy regulations to prevent unauthorized access and misuse of sensitive information. It's crucial to address these issues to maintain trust in AI's technology within healthcare settings. Ensuring human control in AI systems. Human oversight is essential in AI systems used in nuclear medicine to maintain ethical standards and accountability. This control ensures that AI assists rather than replicates human judgment in critical decision making processes, safeguarding patient welfare and trust in technology. Implementation strategies for healthcare providers. Current technology assessment: evaluate existing imaging technologies and identify areas where AI could enhance safety and efficiency. Train the staff. Develop ethical guidelines. Let's create clear ethical guidelines to govern the use of AI, focusing on patient rights, data privacy, and algorithm transparency. Pilot programs where we integrate the AI into hospital and teach the staff how to use it. Continuous evaluation. Call to action: embracing AI responsibly. Call to action: embracing AI responsibly. As we stand in the forefront of technological advancements, it's crucial for healthcare providers to integrate AI responsibly. This means actively considering ethical implications, prioritizing patient safety, and ensuring that human oversight remains central to AI applications in nuclear medicine imaging. And these are my references. And thank you for watching my YouTube video on ethical adoption of AI in nuclear medicine imaging. My name is Meredith Gilliard. Uh, uh, y'all have an absolutely amazing day. Sorry for being awkward.